Hi guys, hope you're well. This is an introductory video on interpersonal skills for your PLAB2 exam. Before we begin, let me introduce myself to you. I'm Dr. Iqbal. I recently passed my PLAB2 exam with 16 by 16 stations. I passed all of the stations, so I thought I should share tips and tricks with you guys as to how you can score maximum marks in your interpersonal skills section. So let me tell you guys the importance of interpersonal skills. How important are these for PLAB2 exam? There are going to be a lot of stations in which you guys won't be able to make a diagnosis or you won't reach the management part. In those stations, this is the section which is going to help you to pass that station. For example, in SEMMANS, a lot of candidates they struggle with making a diagnosis in that station and doing a management. So interpersonal skills is going to be the section where you can score maximum marks and you can ensure that you pass that station. Similarly, there are going to be points when you might just not catch a thing the patient was trying to tell you in the station, and you might lose marks in data gathering. So interpersonal skills is going to be the point which is going to save you and help you pass that particular station, right? So, as we all know that interpersonal skills they carry 4 marks for each station, right? And if you score 4 by 4 marks in this station, and you can easily pass the station because usually the average number of pass marks for each station they vary from 5 to 6, right? And if you score 1 or 2 marks in data gathering or management, you can easily pass the station if you score very good marks in your interpersonal skills session. So how you can improve your interpersonal skills, the way you talk to the patient, the way you act in the exam. I'm going to guide you regarding that, and let us begin. So first of all, 4 very high yield expressions for your PLAB2 exam. Number 1 is smile. Um, Believe me, guys, I can't focus more on this. Smiling is a really important part when you enter the room for your PLAB2 exam, right? You have to smile towards the examiner, you have to smile towards the patient. Put on a very big smile, right? This is a thing very common amongst British people that they smile towards each other. Whenever they greet each other, they smile towards each other. So you make sure that you smile, right? Even though you would be worried at that exam, you would be worried at that time, you would be nervous about your exam, but you make sure that you smile. But beware, if it is a breaking bad news station or it is a patient, for example, if the patient has a history of suicide or the patient is depressed, you are not going to smile in such a station. Otherwise, in every other station, you are going to smile towards the patient, right? So the second expression is your raised eyebrows. Just like the second picture in which the guy is raising his eyebrows, you are going to raise your eyebrows whenever the patient tells you something out of the blue. For example, the patient tells you that, doctor, I've been having this cough from the past 6 months. You are immediately going to raise your eyebrows. You are going to act a little surprised and act empathetic for the patient, right? I'll tell you in a minute, just as we move on, how you are going to complement this expression along with your verbal cues, right? The third expression is to act curious. Just bring your eyebrows closer together, and whenever you have to ask the patient any question, you act curious. For example, if you have to ask the patient regarding their smoking or regarding their alcohol habit, you just act curious and ask the patient, by the way, John, do you drink? Or by the way, John, do you smoke? Right? So this is a third expression. The fourth expression which you're going to use in your exam is head nodding. Believe me, head nodding, even though it is a really very simple gesture, but it carries a lot of weight. Whenever the patient tells you anything, if the patient is venting out, if the patient is speaking and speaking and speaking, you just sit there and you nod your head like this, forward and backwards, and you just let them speak, you just let them vent out. Another thing is your hand gestures. When the patient is giving you any non-verbal cue, you are going to do a hand gesture towards them and tell them, I can see that you're worried, or I can see that you're depressed, right? Another thing is eye contact. You make sure that you look towards the patient even when you're thinking. Do not look towards the roof or the floor. Do not look here and there. Keep your eye contact with the patient, right? So moving on, your tone. Your tone is really, really important during your exam. You have to fluctuate your tone, right? How are you going to fluctuate your tone? Let me give you an example. One thing is you enter the room and you tell the patient, hello, right? Another thing is hello, right? So you're just fluctuating your tone, and the way you are saying hello to the patient, it varies a lot, right? So when you're asking a question to the patient, you fluctuate your tone, rather than saying this, by the way, John, do you smoke, right? A plain, simple, flat tone. You have to fluctuate your tone, and you have to ask the patient, by the way, John, do you smoke? Right, a problem with almost all of us is that when we come from our native languages, um, and we start to speak English, our tone becomes very monotonous and very flat. What you're going to do is you're going to fluctuate your tone and complement it along with your expressions, right? That way you are going to sound natural during your consultation. Basically, that is what the examiners are looking for, whether the candidates they sound natural or whether they sound scripted, or if they're sounding robotic or not. So you don't have to sound robotic in your consultation. You have to sound very, very natural, and you have to fluctuate your tone. Similarly, if it is a case of suicidal patient or a depressed patient, you are going to make your tone really, really soft, right? And in other cases you are going to fluctuate your tone. So I can't emphasize more on the tone part. If it is a happy patient, you are going to make your tone really happy. If it is a depressed or a sad patient, you are going to make your tone really soft and really sad, right? Especially in the case of telephonic conversations and video calls, because in telephonic conversations the patient might not be able to see your face and they might not be able to see your expressions. So in those stations you are going to fluctuate your tone. That is how you can portray your expressions through your tone, right? So let us begin. How you're going to introduce yourself. As soon as you enter the room, you are going to introduce yourself to the examiner, right? And when you are going to introduce to the patient, a generic sentence which all of us have been taught at our academies is, hello, I'm Dr. XYZ. I'm an FY2 in the department. Or can I confirm your name, right? This is a really very robotic intro, which our academies they've taught us. And believe me, the examiners, as soon as you say this sentence, your repo, it immediately goes down in front of the examiner. So during your consultation, don't give a robotic intro. Don't sound robotic during your whole consultation. Don't make it sound like you are going to interrogate the patient. For example, asking them, can I confirm your name? Can I confirm your age? You are not going to interrogate the patient. Be very, very friendly. Be very gentle with the patients, right? So how you're going to introduce yourself? Let me show you guys how I developed my personal way of introducing myself to the patients. The way I used to introduce to them is I would say, hi, hello there, can I get your name? Right? And they would tell me, like, Doctor, I'm John. And then I would tell them, John, I'm one of the doctors in here, right? One of the doctors in here. No need to mention whether you're an FY1 or an FY2 or a junior clinical fellow or anything. The patient doesn't even know who an FY1 is, who an FY2 is, and they don't even care, right? And second thing is, no need to mention I'm in the department or in the hospital or in the clinic, because you might forget it. So just say in here. Just say I'm a doctor in here. I'm one of the doctors in here. So be natural with the way you introduce yourself to the patient. When asking for their name, don't say can I confirm your name, because it sounds just too robotic and like you're interrogating the patient. Just ask them, can I confirm? Just ask them, what is your good name? Or can I get your name, right? That is a really very natural way to introduce yourself and to ask their name. When asking them about their age, don't ask this question, can I confirm your age? Like there is a prisoner sitting in front of you and you're confirming their age. Don't ask this, just simply ask them, how old are you, John? right? You will get to know their age. So a good way to introduce yourself to them is, hello, can I get your name? They're like, John. John, I'm one of the doctors in here. Yeah, doctor, I'm pleased to meet you today, John. So say things like this: I'm pleased to meet you. It is nice to meet you today, John. Right? So be very friendly, put on a smile, even though at the back of your mind you would be very, very nervous regarding your exam and there would be lots of things going on. But on the outside, you have to portray yourself like a clown in front of the patient. Treat the patient, think of the patients like little kids, and you are a clown putting on a smile for the patient. Even though you are very stressed out about the exam, you have to perform really very good. You have to score maximum marks, but that is what you are going to do. That is how you are going to treat the patient, right? Make your introduction very natural and very classy. Do not make it robotic and do not make your tone really flat, right? As soon as you give a classy introduction, your repo will go up in front of the examiner that, okay, you would stand out amongst rest of the candidates, and the examiner would immediately know that we have something new in the market and they would definitely give you good marks in the IPS, right? So as soon as you are done introducing yourself to the patient, you ask them that, how may I help you, John? Or what brings you to the hospital today, John? Right? And John tells you that, doctor, I'm in pain. So what you're going to do is you are immediately going to acknowledge it and empathize with John. You are going to tell him, oh dear, this phrase you're going to say, oh dear, is it? John would say, yeah, doctor, I've been in pain from the past 6 months, or from the past 2 hours, or from the past 3 hours, whatever, right? So you are not just going to acknowledge it, but you are going to empathize with them as well. That if John tells you anything which he has been having from the past 5 6 months, you are going to explore it. That, John, how have you been coping up with it? John tells you, doctor, I've been having this nasty cough from the past 6 months. You are immediately going to empathize with them and inquire about their psychosocial status. That, John, how have you been coping up with it? That is only in the case of chronic scenarios, right? So second thing is, if John tells you something which is really very uncomfortable for them. For example, John tells you, doctor, I'm in pain. Do not offer them painkillers right away. Ask them first that, are you comfortable to talk right now? Or if they tell you that, I'm having this breathlessness, or I'm feeling sick, ask them immediately, are you comfortable to talk right now? Do not offer them painkillers or medication for their symptoms right away. Offer them if they ask them for it. If they tell you that, no, doctor, I'm not comfortable, then tell them that, for example, if they are feeling sick, then tell them, do you want me to give you some medication to make you feel better? Or if they're having pain, do you want me to give you painkillers? Then they'll tell you, yeah, doctor. Then only then give them medications. Do not offer them medications right away. First ask them, are you comfortable to talk or not, right? Another thing, during your presenting complaints and history of presenting complaints, presenting illness, there are going to be lots of scenarios when the patient just won't open up. They are not telling you anything. So don't just offer them confidentiality right away. For example, if a patient is not opening up and you're immediately saying to them that, John, don't worry about this. Whatever you're going to tell me is going to stay between you and me, or between you and the system, right? Don't offer it right away. Ask John, try to explore it. John, is there something worrying you? Is there something you're upset about? I can see that you're embarrassed about something, or you're upset about something, right? If John says that, doctor, is this conversation going to be private, only then offer them confidentiality. Don't offer them confidentiality right away without them asking for it, right? Third thing, another thing is, acknowledge their non-verbal cues. The patients, they're really, really good actors, right? If they're agitated, they would be like moving their leg or moving their hand, or if they're in pain, they would be pointing towards it again and again. If they're embarrassed, they're not making eye contact. If they're angry, they would be acting really, really frustrated. So you have to acknowledge it. You have to look at those verbal cues and you have to acknowledge them, that I can see that you're agitated and you're moving your leg, or I can see that you're worried about something, or I can see that you are upset, or is there something bothering you, right? So this is part of your IPS, acknowledging their non-verbal cues right there and then. That is part of your IPS. Another thing I must mention that, for example, if the patient is trying to give you some cues, right, or if the patient is telling you about pain and about breathlessness, and you don't empathize with them, the patient is going to give you a tough time. But if you empathize with them, if you acknowledge their nonverbal cues, the patient won't give you a tough time from there afterwards, right? So another thing, uh, a major part of your IPS is your eyes, asking them about their ideas, concerns, and expectations. So you have to make your eyes very, very natural. And a lot of candidates, they ask me that what is the best point to ask about eyes. I tell them to make eyes very, very natural, right? And make it very non-formulaic and just blend it into your conversations that the patient, they don't even know that whether that you've done the eyes, right? So a good point to ask about their concerns is immediately after the presenting complaints or history of presenting illness. As soon as you're done asking about Odipara and Socrates, immediately ask them about your concerns. How you're going to ask them about their concerns? You just ask them, John, is there anything you're worried about? Is there anything going through your mind? Is there anything you're thinking about in particular, right? So this is how you can ask them about their concerns, because as soon as you come to know about their concerns, you are going to know how to deal with their concerns and where the patient is leading you and how you're going to deal with this station. And you would know immediately that you don't just have to deal their condition, you have to deal with their concern as well. You have to manage the whole situation, right? So once you're done asking about your presenting complaints, next thing comes your red flags, your past medical history, social history, personal history, right? So before asking their red flags, you are going to signpost them. You are going to signpost them. Remember, make your consultation a smooth transition from one section to another. When you are moving from presenting complaints to red flags to past medical to social, you don't just jump from one section to another. Make it a smooth transition. You signpost them. For example, a patient comes in with weight loss, and you start asking them serious questions. Are you having night sweats? Are you having loss of appetite? Are you having this and that? And the patient would get frustrated that I'm just here for my weight loss. Why are you asking these questions, right? So you tell them that let me ask you a few questions. There are a few questions that I would like to run through to make sure everything is okay or nothing worrying is going on, right? Or you can say that let me ask you a few questions to make sure nothing serious is going on. And let me ask a few questions regarding their lifestyle, as they can have a huge impact on your weight loss or on your headache, whatever the presenting complaints the patient came in with, right? So this is how you're going to signpost. When you're going to ask about past medical history, signpost that I'm going to ask a few questions regarding your medical history. If it is regarding the personal histories, you signpost them, you signpost it again that I'll be asking a few questions regarding your personal history, right? So this is how you're going to signpost, and it is a really, really important part of your IPS. Third thing, you will be using facial expressions during past medical, social, and personal history. Patient tells you something worrying, you immediately raise your eyebrows. Patient tells you that, doctor, I've been having blood in my cough as well. You immediately raise your eyebrows and tell them, oh dear, is it? Or the patient tells you that my father passed away. You raise your eyebrows. Oh, I'm so sorry for your loss, right? So you don't just give expressions, you complement complement those expressions along with your words. Both of these things go hand in hand, your words and your expressions. That is the way that you're going to sound really, really natural in your consultation. When you're going to ask them about their smoking or the alcohol habits, bring your eyebrows close together, just like to act curious, right? So if you're asking regarding them they're smoking, by the way, John, do you smoke? Yeah, doctor. Okay, John, how much do you smoke? Right? So you're going to bring your eyebrows closer together and ask them these questions. Okay, so that is about the expressions. Now, patient gives any input, you are going to acknowledge it immediately and inculcate it into your consultation. For example, the patient says, "Doctor, I have to rush back to my work." So you are immediately going to acknowledge it, and even though you know that you do have 8 minutes, there is no rush there, but you are still going to inculcate it into your consultation, and you are going to reply, "Okay, John, I can see that you have to rush back to your work, so I'll just make this very quick for you." John would say, "Yeah, doctor, that would be perfect," right? So even though you know that you still have 8 minutes, but since the patient is saying that I'm in a rush, so you just reply back to them that, "Okay, sure, I'll make it very quick for you," right? So it is also a part of your IPS, and believe me, if you do these things, you would easily score 3 or 4 marks in your IPS section, right? Another thing, as I mentioned before, that you have to act like a clown, and the patients are just like kids. The reason I mentioned it, that the patients, they have a very short attention span, right? So you have to keep them involved in your consultation. When you're asking them, don't give a when you're talking to them, don't do a monotonous tone, fluctuate your tone, make them keep them engaged in your consultation, especially during the management section, right? So keep them involved, keep asking them, is there anything you're worried about, is there anything you're concerned about, right? So, another thing, while asking the personal history of the patient, especially smoking, alcohol, and sexual history, you are not going to judge the patient. Don't make your consultation sound judgmental or interrogative. Believe me, you are going to lose marks in the IPS section if you do this. For example, if you're asking about alcohol to the patient, ask them in a very non-judgmental way. Do you drink? John would say, "Yeah, doctor, sometimes." Don't make it sound like, "Do you drink alcohol?" Like you're sounding that the patient is doing something fishy, or if you're asking them about relationships, if John comes in and he tells you that I have a wife and I've been having relation with another female as well, so don't sound judgmental at all. You are there to help the patient. The patient is there with a problem because they don't have anybody else to talk to, and they are there to talk to you regarding that problem, and you have to help them with their problem, right? So if you are going to act judgmental, um, you are not just for the exam but in actual life as well. Obviously you are going to lose the patient's trust, so you don't have to act judgmental at any point, no matter what the patient tells you. The patient tells you that I'm attracted to someone from the same gender, I'm doing this, I'm doing that, you are not going to sound judgmental at all, right? So ask them in a very non-judgmental way, right? Like, do you drink alcohol? Yeah, doctor. Okay, and what about smoking? Yeah, doctor, I do smoke. Okay, how much do you smoke? Okay, yeah. So about relationships, are you in a stable relationship? Just ask them this. No, doctor, I have multiple partners. Okay, just move on. No need to act judgmental at any point, right? Next thing is sexual history, a really, really important part of your consultation, and especially your IPS. You have to ask sexual history, but don't be explicit. Don't be very, very explicit while asking your sexual history, but get the required information out of the patient, right? How you're going to do that is, yeah, I was listening to a mock of a candidate, and the way they were asking questions to the candidate was somewhat like this: Do you use condom? Right? So this is not how you're going to ask the patient. First thing, it is very explicit. Secondly, it is very judgmental, right? The way you're going to ask the patient is, you're just simply going to ask them, are you sexually active? This is before asking sexual history, you are going to tell them, you are going to signpost that, John, I'll be asking a few questions regarding your sexual history. These questions might sound a bit intrusive, so just bear with me for a minute, right? So John would get ready that, okay, these questions are going to come. Next thing, you ask them that, are they sexually active? Um, are you sexually active? Obviously, the patient would say, yeah, doctor, I am. So next thing you're going to say, okay, are you in a stable relationship? By this, you're asking them whether they have a single partner or multiple partners. You are asking it in an implicit way, but you are getting the required information. Are you in a stable relationship? Whatever the answer is, move on. Ask them. Next thing you want to ask is whether they're using contraceptions or not. You're going to ask them, John, do you practice safe sex? Okay, and this is the question which is going to tell you whether the patient is using contraceptives or not. If you're going to ask them which sexual intercourse they prefer, for example, vaginal or anal, just ask them a very implicit question: which routes do you prefer? This is going to be your question: which routes do you prefer, right? If they tell normal or any, so you will get your required information, right? So this is how you are going to take sexual history while sounding implicit, while maintaining your professional integrity and getting the required information out from the patient and very sounding non-judgmental, right? Okay, so let us move on. Now coming towards the investigation part and examination part. When you're done taking your history, what you're going to say is that, okay, John, I would now like to check your observations. You are not going to say vitals, because a lot of the times the patients, they don't get what vitals are. The observations is a pretty layman word, and they would get what you're trying to say. But if they don't get what is observation, just mention to them that I'll be checking your blood pressure, your temperature, your heart rate, and your respiratory rate. Okay, so a lot of the in majority of the stations, the patient would understand what you're trying to say, but if they don't, they would ask you. That is going to happen very rarely, and so you just explain to them and move on. Next, when mentioning about the labs, right? Don't just start blabbering all the labs that you can think of. For example, if the patient has come in with a septic shock and you start mentioning, I believe, sending your CBC, ESR, CRP, TFT, KFT, LFT, the patient does not know what these are. Remember, I told you that patients are like little kids. You have to keep them involved. You have to keep them engaged. Give them a little information to feed on, let them digest it, and then reflect back whether they've understood, and then move on, right? So when you are mentioning about labs, mention the labs which you are going to send, and mention the reason as well. So, for example, if you will be sending CBC, ESR, CRP, don't mention these tests because the patient don't know what these tests are. Just mention that I'll be sending your inflammatory profile or your inflammatory markers to check. Now you are going to mention the reason as well, that I'll be sending these tests to check if there is any infection or inflammation going on in your body, right? So similarly, if you want to send the thyroid function test, the liver function test, and the kidney function test, you are not going to verbalize all of these tests. You're just going to say, I'll be sending your organ tests, right? To make sure all of your organs are working properly, right? Next thing is, for example, if you have to send all of the routine tests, you just mention that I'll be sending your routine tests or your basic workup. There's another thing known as MOT in the UK, which is done for cars, and MOT is a basic annual checkup of the cars, right? So you can mention it to the patient as well that I'll be sending your annual MOT, which sums up all of the tests, all of your routine tests. You can say it this as well. The patient would most likely understand, right? So up until saying the examination part, you would use the word I. You will mention that I will do your examination. Once you've done saying that, beyond that part, you are going to use the word we. For example, during your consultation, you will be saying, I'll be asking these questions, I'll be asking these questions. Now I'm going to ask about your social history. During the examination investigation part, you are going to say, John, I'll be examining your abdomen now or your tummy now to check if there's anything serious going on, right? And when you have to talk about the investigations, you are going to say, John, we'll be sending these investigations. Don't use the word I at this point. And from that point onwards, you are going to talk we. You are going to say that we are going to prescribe you these medications. We are going to recommend you these lifestyle modifications. Always use the word we in your consultation. Never say that I'll prescribe you medications. I'll recommend you lifestyle modifications. During the management part, use the word we. Okay. So let's move on towards the diagnosis and the management part. As soon as you are done telling the patient about the investigations and the examination, and before disclosing the diagnosis, you have to ask about the patient about their ideas in a very natural way. Just simply asking them about, do you have any idea what is going on, is a very like formulaic and very robotic way of asking the patient. Another good way of asking the patient is there anything going through your mind? Is there anything you're worried about? Is there anything you thought that might be going on, right? So you're just asking them about their ideas and you're being very natural. Next thing is that before disclosing the diagnosis, you are going to explain to them the results of the investigations. For example, um, if the patient they found that CEA was positive, you are going to, before disclosing the diagnosis, you are going to tell them that on your reports we found that CEA, which is a type of protein, it is positive, which means that you are having this condition, right? If the patient is having any bacteria in their body, you are going to tell them that we sent this test and the results of this test include that the following bacteria is positive, which means that you are having an infection, right? So you are going to first explain to them the results of the investigations, then you are going to tell them what exactly is the diagnosis and what does it mean by that diagnosis. For example, if the patient is having ulcerative colitis, you are going to tell them that it is an inflammation of the colon, right? So first comes the results of your investigations, then the diagnosis, then you have to explain to them the diagnosis in layman term. Okay, so by this time you would reach here a lot of candidates, they struggle with completing their management. A great way to say out your management in one simple to secure your marks for your management is to say the whole management in one single line. For example, if there is a patient with diabetes and you have to tell them about lifestyle modifications, you have to tell them about medications, and you have to tell them about insulin as well. So you are going to just summarize the whole management in one sentence when you begin your management. You are going to say that, John, I'll be talking about your lifestyle modifications, about your medications, oral medications, and the insulin. Which one? And then you ask them that which one do you want me to talk about first? Because there might be, it is possible that the patient is already aware of lifestyle modifications and now they want you to talk about the insulin part. So just start telling them about the insulin part. Similarly, if there is a condition in which you have to talk to them about lifestyle modifications and then the medication and then the surgical part as well. So you mention everything in one single line at the start of management. You tell them that, sorry, I'll be talking about your lifestyle modifications, your medications, and then the surgical procedures which can be done for your condition, right? So these are some of the that is how you are going to secure your marks for management, so that the examiners, they know that this candidate is aware, of the whole management, and you secure your marks for your management, right? And again, during your management part, you'll be speaking more than the patient. During the history part, during the data gathering part, the patient would be speaking more. But during your management part, you would be speaking more. So don't just start blabbering everything out. Don't just start, I would say, puking everything out. All of those books which you've shoved down before the exam, which you've swallowed before the exam, don't start puking everything out, right? Keep a hold on to their management. As I've told you before, that the patients are like little kids. You give them a little information, you give them little food, then give them some time to digest that, to take some breaths, and then give them more food, right? So information is just like food for them. You're going to give them little information, you're going to pause for a few seconds, ask them that, is it clear? Is everything clear? Does that make sense? Are you with me? Are you getting me? You are going to ask them again and again to make sure that they have digested the information, and not just asking them. You are going to ask about their concerns again and again during the management part, because there are going to be lots of questions coming in the patient's mind at that point, and you are going to ask them, are there any concerns, is there anything you're worried about, are you getting me? If there isn't anything clear, you can stop me right there and you can ask me, right? These are some of the sentences that you are going to say during your management part. Okay, so after every station, make sure that you do safety netting and follow up in every station. Safety netting is a major part of every station. For example, if the patient has come in with cough, and you are going to tell them that, John, if you notice any blood in your cough, you make sure that you come back to us. Or if the patient has come in with fever, you are going to tell them that if you get high grade fever, or if you start to get fits or anything serious like that, you are immediately going to come back to us, right? Next thing is follow up. You are going to mention it to them that we'll be calling you for a follow up after 1 week or 2 weeks or a month or 6 months or a year, right? You are going to mention follow up in every station. So if at the end of the station, there are going to be lots of stations in which you guys would be left with 1 or 2 minutes at the end of each station. So don't panic in those stations that there was something that you guys missed, even though you would have covered everything, but still there are going to be some stations in which you would still have 1 or 2 minutes left. So in those stations, you can mention about leaflets. When you're done with everything, you have said the management, you've done safety netting, you've told them about follow-up. Now you can mention about the leaflet when everything else is done, just to kill time. And remember, guys, don't just mention about the leaflet thing. Like you can have a leaflet for your condition. No, you are going to tell them the reason that why you're giving them the leaflet. You are going to tell them that it contains all of the information regarding your disease and how you can manage it, right? Similarly, if you're going to mention about the incidence report form, don't just mention that I'll be filling in an incidence report form. Mention the reason for it as well, that the incident report, I'm going to fill an incident report form and it is reported nationally throughout the NHS, and we make sure that such incidents, they do not happen again anywhere in any of the hospitals in NHS, right? You are going to mention these things. Okay, so